Hello and welcome, my dear friends. I am your friend Pradeep Kumar Ojha, and today I am here to discuss with you regarding the WHO, that is World Health Organization. My dear friends, WHO is an organization which comes under into the United Nation. The parent organization of WHO, that is UN. So in this lecture, I we will devote on the WHO. So what things have to be discussed in this lecture that I have mentioned in this content. So very first of all, we will talk about the introduction of the WHO. Then what is the establishment year of WHO? Then again, where is the headquarter? And who is the present director general of WHO? Member countries. What is the budget of WHO? And which country is giving most fund to the WHO, and what is the most function or the objective of WHO. These things have to be discussed in this lecture series one by one. So let's get into the deep regarding this topic. So my dear friends, here I mention the very simple definition of WHO, that WHO is a specialized agency of the United Nations responsible for international public health. Right, as we know that very well, WHO, that is World Health Organization. This is international organization. This organization, has been furnished to observe worldwide the health of the people. Right, so. The main opinion or main objective of this WHO is the public health, to watchdog on the public health. And right, so the second is WHO constitute states its main objective as the attainment by all the peoples of highest possible level of health. Means each and every organization has its own chart or its own constitution, what rules and regulation has to be followed. In same manner, here is a constitution that has been made for the WHO. So in this, the main motto or main point of this constitution of WHO, that is the highly possible or highest possible level of health should be attained by the people. Right, the main objective or main priority of WHO should be like that each and single person can get the possibility of high level of health system in the entire world. Now next, here we can see the establishment year. So let me tell you, the WHO was established in 7 April 1948. This question, my friends, let me tell you, before 3 or 5 days ago, MPPSC exam was held. So this question directly asked, what is the establishment year of WHO? The correct answer was 7 April 1948. Right, so my friends, so many competitive exams where they keep asking the establishment year of the international organizations or their headquarters. Right, so again, if we discuss about the WHO's headquarters, so it is situated in Geneva, which is in Switzerland, and this Switzerland comes in the Europe continent. Right, and apart from this, the headquarter, it has 6 regional offices. Means that this six regional offices we can understand like that. In some so many continents, there are one main big institution where the entire region or entire continent can be particularly observed. Right, and apart from this, there are small field offices in worldwide, that is 150 of the WHO, so that we can particularly emphasis on each country, and we can follow the rules and regulation of WHO for the particular country in the field of medical. Okay, so these about why the establishment year and the headquarter. Now again, here we will discuss about the current director general of WHO. So my dear friends, as you have seen this picture since 3 years ago, more and more again, since pandemic, as COVID pandemic has come into in our society, this person has keep made so many information or instruction towards the worldwide. So this person is a director general of the WHO, and his name is Tedros Adhanom Ghebreyesus, right? Tedros Adhanom Ghebreyesus, this person from Ethiopia, which comes in the African country, right? Dr. Tedros has been elected in 2017 for terms of 5 years. Okay, one thing you must understand, that the tenure of Director General of the WHO is 5 years again, and this person has been appointed in 2017, right? And there is a 17th General Assembly held. That time this person has been had been elected, right? After taking the office, he immediately outlined five key priorities for the organization. Means, when he take oath or come into the office, he had some, each and every person has some its personal opinion or personal things that he or she want to do for the society. So he also uh, make a focus on universal health coverage and health emergencies on the women, children, and adolescents. You know, universal health coverage. You must have heard in our India also about the universal health coverage, that that is Ayushman card. You must have heard about it. This card also give a facility for each Indian person of 5 lakh coverage for every year in any family, any member who has some serious disease. So that person can directly reach to the any government hospital. And apart from the government hospital, there are so many private hospitals also making their service in terms of Ayushman card, right? So this is such a very important policy of the WHO. Or I think there are so many countries who are following this universal coverage health emergencies, right? And also they are also observing on the women's condition, their in terms of their health, children in terms of fatalities or childbirth ratio, right? Adolescent, how what should be the exact nutrition for adolescent, so that they can develop their body for the future disease. So these all about the Director General of WHO. Now next, we will talk about the member nations and its budget. So my dear friends, as we have mentioned in the previous lecture, in the United Nations, there are also 193 members. Here one more, that is 194 member countries of the WHO. And again we make our emphasis on its budget. So 2022 and 23 three's budget hasn't been published, but I have cite the budget of 2020 and 21, that is 7.2 billion dollar American dollar. So I think there's a huge budget of the WHO, and I think this budget must be increased in forthcoming time. So we will mention about the who is giving more contribution towards the WHO. So my dear friends, in terms of contribution, so there are two kinds of party come forward to help the WHO in terms of financially. One is international organizations, and second one is a voluntary person or some private institutions, some private persons who has a big who has enough money. So they will come forward to donate some money in the account of WHO. So here Germany has been give a good example, because Germany give financially assistance of 12.5% of the total budget, right? Whatever the budget of WHO, as we have mentioned, 7.2 billion dollar of budget of WHO. So the 12.5% of 7.2 billion dollar, it comes from the Germany. Then second position, Bill and Melinda Gates Foundation. There is a big industrialist, Bill and Melinda Gates. You must have know about sorry about them. So they have also give a good amount, 11.65% of the budget. And United Nations again 7.85% of the budget has a third position, right? And apart from these three uh, group that they are giving their financial assistance towards the WHO, there are so many private institutions also, they are giving charity to this WHO organization. Okay, so again we will discuss about the main or important points. What is the objective of WHO? My dear friends, actually I have made some so many slides in different levels. If we go for the UPSC CSE sort of exams, so sometimes international organizations may be asked in the prelims examination, but prelims sort of exams, in UPSC, they they go in some depth of any topic. So they may ask the question from the objective or function of WHO. So we will discuss all the objectives of WHO one by one. So very first, that is, WHO mandate seeks and include working worldwide to promote health, keeping the world safe and serve the vulnerable. My dear friends, here WHO is such as organization, that observe, right, that promote some things towards the health in worldwide, right. They also emphasize on the hygiene in worldwide also, or there are so many vulnerable countries or species, they are facing some environmental problems. So WHO, seeks or find out some solutions toward the living organisms. So this is the main objective of WHO. The second is, it advocates for billion more people should have universal health coverage, right. Apart from this, WHO again emphasizing or forcing all the countries who haven't launched this universal health coverage sort of policies. That is very important. My dear friend, there are so many country, in that country there are so many poor people. If they suffer any critical disease, so they do not have enough money to cure their disease. So if government will help them out, so they will lead their life furthermore, right. So WHO is initiate WHO's this initiative is very important. Or I think this universal health coverage sort of scheme should be spread entire the world, right. The second is engagement and monitoring public health risk. Apart from this, as I have mentioned earlier, WHO is keep monitoring the environmental conditions, the public health, whether all is smoothly going on or not. And if some any foreign elements or foreign disease come in any society, so they also keep observing the risk in terms of health. The third point is that coordinating response to health emergencies and promote health and well-being. Again, the third point is also similar to the above 2 points. That is, they are coordinate with some all another health agencies, or apart from this, they show or they tell some more points, some more things by which if we use in your life, so you can promote your health conditions or your well-beings also. So WHO has a good platform where each and every time the research work is being done, and that these all the research work are done for the human beings also, and they keep telling the human beings which things you must follow, or what kind of diet you must take, by which you can get energized, or you lead more life, right. So the next point may be the provides technical assistance to the country, sets international health standards. All right, this point is again very important, and I will discuss quite quite deep about this point. Provides technical assistance. My dear friends, there are so many medical equipments that come into handy for to cure the process. Suppose example, if you are in the medical field, or you are a doctor, so if you are come on the platform and you want to go for the surgery, so you must have a good kind of tools and machines that can give you a full length supports, and very give the precisely result of the human body. So if any country facing any problems in terms of making medical tools, so WHO will come forward to help that country out to making such technical assistance, and set international health standards. Apart from this, WHO keep telling some standards. Standard means that it tells about the hygiene of anything. Whether you talk about, suppose if you live in in any country or any city, so there should be a one standard value of the noise. What kind of noise you, the human being, can be hear without disturbing the hearing capacity, right? In same manner, if you take water, so what should be the purity of water that you must take? If there is a pollution, you're drinking water, so there is a standard value of WHO. If you take water in this, under this standard condition, so you are very healthy, or you are quite away from the disease, right? So WHO has made so many standard for the human beings, and again to provide the world health reports. And apart from this, each year WHO make the report worldwide, which country is improving their health condition, their health infrastructure, or which country is declining in terms of health infrastructure. So WHO keep telling or keep showing their reports on the international platform, right? The second point may be right. WHO serves as a forum for discussion of health issues. Very, very important points, my dear friends. Since 3 years ago, we have seen in the news channels, WHO such a platform where all the medical doctors, medical person come on the platform where they can discuss to remove the disease. As we have know very much about since the COVID-19 came in our society, so WHO members. They come on the table and they keep discussing what should be the vaccine for this dangerous disease, what should be the preventive action that should not be spread in our community. So this is a organization where so many things are discussed, or so many brainstorming, so many kind of things keep happening, right? So now let's again, apart from the discussing about the WHO's objectives, now we must again make claps for the WHO. So here we will share about the achievements of WHO. So my dear friends, WHO has given such good action in some kinds of disease. So it has eradication of small facts. Before WHO, in WHO, there are a big disease, that is smallpox. You must have heard, or you must have seen in a locality, or sometime in your home. This is a disease, or a viral disease. If someone come into touch with this disease, a person has a small swallows on their bodies, pimple kind of things, and he also gets some severe fever, and fatigue sort of things happening. So nowadays there is a strong, or ready-made cure, or the we can say here the treatment for smallpox that has been made by the WHO. The near the eradication or polio disease, you must have seen nowadays under the 5 year, a child that keep taking the polio sort of drops after some months or some years, and this polio drop should be given to the children till he or she get the age of 5 years. Before the polio medicine, there are so many fatalities keep happening in our society. So WHO has given a good work to towards the polio, and nowadays we are on the verge to eliminate this polio sort of disease from our society. And third one is development of Ebola vaccine. There is again Ebola, as we have seen in COVID-19 or coronavirus sort of things. Apart before this, there is a Ebola virus also in our society. So the symptoms of Ebola is all again like this: person gets severe fatigue, severe fever, and he has so many swallows on their bodies and some pimples, and a person get so many tired and come on the bed in few days. So this Ebola virus has been eliminated from our society, or there is a big or a strong vaccine to fight with this Ebola virus. So these works have been done by the WHO. Now we will discuss about the future responsibility of future work of the WHO. So current priorities include, you know, still in our society so many things has set their foot that these diseases are very harmful for the human beings as well as living organisms. So very first of all we will discuss about the communicable disease. Before going about the communicable disease, you must know what is the meaning of communicable diseases. My dear friends, communicable diseases are th- those diseases which can spread person by person, by the spitting, by the sneezing, by the coughing. These sort of things can be spread by from one person to another person. For example, HIV, AIDS. This disease is very harmful. There is no strong cure for the AIDS, but you can prevent your life for some times. But person definitely going to the die after some years or some month. Again, Ebola virus is again have some problem. COVID-19 is still so many vaccines by the countries has been developed or launched for the human society, and they also get vaccinated of the COVID-19. Is still for the children's or underage children's, this vaccine has been developed for the society. Then again, malaria, tuberculosis, these are communicable diseases, and we have done a lot of work on that. Malaria also sort of is a virus that can spread one person to another. This disease happened due to the mosquito, right? And tuberculosis is again, this is again a virus sort of things. And if person is suffered from the TB, that is tuberculosis, so he keep coughing, and he may get very thinny body, or after sometimes he is very weak by physically or mentally. So these are the communicable disease. Now again we will talk about the non-communicable disease. Non-communicable disease means that those disease which cannot spread from person to person, but person can come into the grip of this non-communicable disease by birth, or by not using healthy diets, or there is a not a good lifestyle. So many disease may come in their body. For example, there is heart disease, cancer, cancers. Heart disease may happen due to, if some they have two kinds or two types, due to which heart disease may happen. Very first is by birth or congenitals maybe happen, right? Second is a person not getting healthy diets, there he is taking lot of fats, cholesterol, so due to which the some hearts veins may close by the fat, excessive fat. So there is chances of heart fail. And cancer, again, there are so many things we are eating things, or so many reason may happen due to which, like tobacco, smoking, drinking, these all are responsible for the cancer, right? Again, WHO working for the healthy diet, nutrition, food security, occupational health. What does the mean of occupational health? For example, if you are working in any company, so there are some parameters that must be checked before into working. For example, there is safety for your there is good safety environment for your working, good machines, some safety equipments for you if you go for the work, right? Hygienes sort of things for you, right? The again is substance abuse means if you take alcohols, smokings, tobacco chewings, these all comes into the substance abuse, right? So these are the non-communicable disease that things is also being discussed in the WHO. So I hope, my dear friends, this is uh, complete lecture on the WHO. I hope people you must enjoy or learn something from here. If you like, please subscribe my channel, and also share this lecture for your companion, so that he can get advantage of this lecture series. Thank you very much.